The WHO's policy-making World Health Assembly convenes, with Chinese President Xi Jinping pledging $2 billion to COVID-19 response, along with a humanitarian crisis veto and a shared vaccine. Also, the hard lessons and biggest takeaways on pandemic control and experience of South Korea. And the G20 talks about measures to ease the pandemic-driven economic crisis, but China-US trade tensions take a turn for the worse.
This involves a mixture of intellectual property, trade, and investment regulations that will have to be revisited in light of the experience of the COVID-19 pandemic.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. Today, we are focusing our attention on the very important World Health Assembly. As you may know, the World Health Assembly is the governing body of the World Health Organization. Today, it begins with teleconference. This time, its significance is much greater than the ordinary days with the backdrop of COVID-19 pandemic. But the question really is, can the world come together with solidarity against COVID-19? Can the world overcome the geopolitics and the collapse of economic sufferings to be able to work together on global health? After all, it is our health. Before an interview with a frontline doctor about all of this, take a look at this.
The 73rd session of the World Health Assembly has been slashed from 3 weeks to just 2 days. Ironically, during one of the modern world's biggest health crises, Chinese President Xi Jinping said it was crucial the meeting went ahead.
在人类抗击新冠肺炎疫情的关键时刻,
it is meaningful and critical to hold a meeting at this time amid COVID-19 pandemic. The virus has hit more than 210 countries and regions across the world. It has impacted 7 billion people. The disease has taken the lives of more than 300,000 people. I mourn the individuals who lost their lives to the virus. I also want to express my condolences to the families who lost their loved ones.
President Xi called on all nations to do more to bring the pandemic under control. He said China would continue to share its knowledge on the virus with the world.
经过艰苦卓绝努力,
After collective efforts and suffering great losses, China has turned the tide on the virus and has safeguarded people's health and livelihoods. All along, we have acted with transparency and responsibility. We have provided information to those in governance in the most timely fashion. We released the gene sequence as soon as it was available. We shared all information and knowledge with all relevant parties. We have given our best to support and assist other countries in battling the virus.
Xi made a few proposals near the end of the speech. First of all, he called on all parties to continue prevention measures, enhance testing methods, and to work towards developing a vaccine. Sharing information in a timely manner was also necessary to stop contagion. Secondly, he said the WHO should lead the global effort in fighting the virus. China will provide $2 billion in international aid over a 2-year period. Thirdly, Xi called for more assistance for African nations. 46 Chinese medical teams stationed on the continent have all joined the effort in battling the disease. Fourth, Xi said the global public health emergency response system needs to be enhanced. All parties should establish an efficient response mechanism in reaction to future events. Fifth, the restoration of economic and social development in an orderly fashion should be conducted under the guidance of WHO. Sixth, Xi said the outbreak has shown us that the world is a community with a shared future for mankind.
让我们携起手来，共同佑护
We will work together to safeguard the health and livelihoods of people around the globe. Together, we will work to protect the earth and build a public health community with a shared future for all mankind.
President Xi said China would continue its efforts to develop a vaccine. He said it would become a public health product to be used in combating the virus.
That's the latest on the ongoing World Health Assembly. The pandemic the collapse of the economy, and the geopolitics exacerbated by COVID-19, all of these cast a doubt over whether the World Health Assembly can be a success. But many argue around the world this must be a success. After all, it is the global health, our health, that we're talking about. The message is very clear from the frontline doctors. For example, Dr. Alice Hyun-Kyung Tan, a frontline doctor coming from South Korea. Her argument is clear and loud. Let's listen. South Korea have managed to get the tests done, and particularly at the early stage, it was one of the countries that really standing out in this regard. And now later, of course, Germany is also doing it very well as well from the other parts of the world. How did you manage to do it with so many people, efficiently done? And what about the accuracy? What kinds of tests would you choose? There are a whole range of questions related to it. Dr. Tan.
So in terms of testing, we did have a little bit of good luck, I would say. In December, the Korean CDC ran a tabletop exercise for an unknown coronavirus. And so we had a little bit of a blueprint in terms of what would need to be done in case an outbreak happened. It was kind of fortuitous. And then we had a very quick emergency use approval for making domestic test kits, and we approved 5 companies right off the bat so that we can get domestic production of kits. And so we were able to ramp up the testing very quickly. In terms of the accuracy, the test is very accurate. PCR tests are very accurate, so they're very sensitive. They're good for initial diagnosis. One problem that we've had, I don't know if it's a problem, but when people who test positive, they're cured, they test negative, only to test positive again a few days later. And we've had more than 100 such cases, and it's been a little bit of a puzzle, but what we've concluded is that these people are not contagious. It's just dead viral fragments that are being picked up by the PCR test. That's how sensitive the PCR test is. So it's a very, the PCR tests that we're running, they're very sensitive. We are moving now to pooled sampling. In other words, we are testing large masses of people sort of all at once just to see if COVID-19 is in that population. And then we will probably do antibody community-based testing as well. That's in the plans. We haven't started yet.
It's very crucial, isn't it? But the question really is, as things continue to get worse, more people infected, more clusters of outbreaks, and probably the pandemic spread even wider, there's even more possibility of having complications related to the virus. So the important point, as they say, Dr. Tan, you know this much better than I do, is to make sure to control the spread of the virus and the disease. But obviously, in some countries, it's very difficult. You have seen the numbers. So what can we do now, Dr. Tan?
Right now, so there are countries that are now going into their uptick of cases. And I think the WHO is very cognizant of this. And so for countries that can help other countries get over or try to mitigate their rising cases, I think that's, in terms of global cooperation, that's something that needs to be done. There are places such as the United States where they had a huge epicenter in New York City, but the United States is a huge country, and there's still very free interstate travel. And so there can be spread and outbreaks in rural communities at any given moment. And so I think what needs to happen is people need to learn from the examples, the painful examples of other countries that have gone through this COVID situation, in the past, such as Korea, such as China. Learn from our examples and prepare now as much as you can in terms of the infrastructure, the testing, the isolation facilities. Remdesivir is a potential treatment It was approved for emergency use in the United States. And so that's a medication perhaps that should be, made available to the most severe cases to prevent death. There are a lot of things that countries can do because we know so much more about COVID-19 now than when it was first beginning in December and January.
Exactly.
So, there are a lot of measures that can be taken to limit the damage of COVID-19.
The price has already been paid. Don't let that price be paid once again. The other countries really need to know what's going on, what has gone wrong, what needs to be learned, and everything needs to be prepared. With the winter coming, Dr. Tan, how are you and your colleagues preparing, for all the possibilities and the scenarios? I mean, if I were you, I would have difficulty sleeping because there's just so many possibilities you have to work on in order to prevent further spread. But even if you work on them, it doesn't mean it wouldn't. So it's mind-boggling, absolutely.
So the first and most important thing is let's do what we can. So the first thing is make sure that everybody universally gets an influenza vaccine this year, without exception. So we want to be able to eliminate sort of the confounding factor of influenza into the winter acute respiratory illness scene. The next thing that we're doing is we're preparing acute respiratory illness screening centers throughout the country. They're going to be both in the private and the public sector. These are going to be freestanding. So if a person has suspicion, they have fever, cough, symptoms of an acute respiratory disease, rather than going into a clinic or a hospital where they have the potential of spreading their illness, we are going to be setting up these freestanding centers that are very easily accessible, that will have X-ray capability and testing capability, monitoring and triage capabilities, so that we can catch the cases early. In addition, we have already established a very robust public health system in terms of testing, tracing, tracking, isolation, and so those will all have to be mobilized. We do realize, however, that there may be a shortage of ICU beds, like there were when we had our Daegu outbreak, and so we are working now on preparing more negative pressure isolation beds in the ICU, and we're also talking about building a dedicated infectious disease hospital. Hopefully it will be ready by this winter.
Another thing I want to ask you, of course, is about international cooperation. You earlier mentioned some part of it, but let me go more specific. Dr. Tan, about the region, Northeast Asia. Now, we were, in your words, in the fire first, and we apparently came out of fire also quite early. So now, 3 countries, China, South Korea, Japan. What can we do despite of clusters of outbreak? General situation is still quiet. So what can we do? Is the possibility to have partial normalcy in terms of traveling, interaction among the 3 countries? I don't know. I want to ask for your professional opinion.
That's a really good question. I think the first 2 countries to start that in the Western Pacific region would probably be New Zealand and Australia, because New Zealand has done such a great job, and Australia has also gotten their COVID-19 situation under control. It may spread to, as you said, Korea, China, Japan. However, I would like to see the situation calm down a little bit more in Japan, also in Korea, before we start opening our borders. Our borders are open to trade. They're open to exchange of ideas, just not to international travel quite yet. I think it is a little bit early, but it is something that we can think about in terms of when we do open up our economies more, are we going to allow travel, and rather than traveling extensively to, say, the US or to Europe, perhaps regional travel will be allowed. I think Jacinda Ardern talked about expanding our bubbles of travel in a staged manner as a way of managing COVID-19. So that is something to consider.
We'll see how things are. Coming week, we're likely to see the World Health Organization having its annual meeting. Now, this is very important, and this year couldn't be more important. So, as a doctor on the front line, who I've been talking to on and off many times, Dr. Tan, what do you think are some of the priorities now? The World Health Organization as the platform internationally to work on with all its member countries. And to you, what mattered the most as a frontline doctor?
So the World Health Organization, they are organizing what's known as a solidarity trial, looking at potential therapeutics for COVID-19. And this is happening on a global scale with resources being poured in that at an unprecedented level. So as the coordinator of this trial, they're playing a very important role. They're also playing an important role in coordinating trials for vaccines. They are also, of course, surveying the pandemic throughout the world, identifying hotspots, identifying countries that need more help, that need more resources, and making sure that the resources are allocated correctly. And so they play such an important role, and they're providing guidance. They are getting all of the information every day, and in terms of research, in terms of epidemiology, and they're making it known to the public. And so I am looking forward to hearing what goes on in that conference, and hopefully they will be able to give us some insight as to what to expect in the future.
Yes, indeed. And lastly, before we go, there are so many debates about, the virus origin, and which country should do what. What do you make of it? I mean, sometimes this is a war of words that we have seen every day in the front line. Does not help us to cure any disease, does not save any children. Dr. Tan, what do you make of those things that are always in the highlight every day?
I think they are quite unfortunate. I think, as I said, they are distracting us from the one true enemy, which is COVID-19. And we can't afford to have distractions.
No.
The most important thing now is, how do we prevent death? How do we manage this disease so that it causes the least amount of impact to our society? And having these debates about where did it originate, it really doesn't help the situation.
Dr. Tan, how can we wake them up?
How can we wake them up?
How can we wake them up?
So I talk about closed loop communication. So the public health experts have been talking about COVID-19, from the beginning. But it seems that the public did not receive the message, the intended message. And so I think as public health officials or doctors, people in healthcare, we can't just say, okay, well, we told you so, and then leave it at that. We need to make sure that we close the loop and that our message has the intended effect, the intended result. And we need to follow through and make sure that that's the case. And if we need to use ambassadors, spokespeople that the public can relate to, sports stars or celebrities, I think we need to do that. We need to use whatever means necessary to make our communication more effective. We need to make sure that we combat any infodemic that's going on, any false information. We need to make sure that that is cut off. And communication is so key, because the public, every single person, needs to be on board. And so the government, everyone, the public health officials, and then ordinary citizens, they all have to be unified in this effort to combat COVID-19.
Dr. Alice Hyun-Kyung Tan, always my utmost respect for you and your colleagues who are making these efforts you just mentioned every day, every minute. Really appreciate it.
Thank you.
That's the frontline doctor coming from South Korea. The message is loud and clear. As she indicated, at this time of global pandemic, we should put the scientists, the researchers, and also the health officials front and center, while politicians and the government should be behind them and provide all the support.